Welcome back to Aging and Awesome. We are joining you from South Reno tonight, where we're at Reno Regenerative Medicine, and we are talking with Dr. Lloyd Decker. Thanks for joining us again.
Good to be here.
You know, back and neck pain are problems for people of all ages.
A lot of people have back and neck pain.
How do you know when it's serious enough you need to come in and actually be checked out, or just wake up with a stiff neck, you know?
It really depends on how fast you want it to go away. Because if you have neck pain, that's a symptom that something's wrong. And you know, it's like, what's the first symptom of a heart attack?
Doesn't your heart hurt?
A heart attack.
Oh. Okay.
So, you know, symptoms are usually the last thing to show up. So if you have neck pain, that usually means something's wrong in there. And you should get it checked out because you don't have to live like that.
Right, but you said if there's radiating pain, if there's like complications to it.
Well, sure, if you've had neck pain for a while, it might get so bad that you have tingling down your arms or something like that. And that's real bad because that means you have, you know, a nerve problem in your neck or your low back. And that you should get it looked at right away so it doesn't get worse.
And back pain is one of those things that people end up on opioids with.
Unfortunately, yeah, it's the number one reason people get prescribed opioids.
Yeah, and so they need to be careful of that, but you treat it differently without any kind of drugs, really.
That's right. You know, we're an integrated medical clinic, and we do not prescribe opioids. You know, our mission is to get people their health back without drugs and surgery. That's what we're all about.
So what do you do that's different?
We try to create the ideal environment in people's bodies for them to heal, whether it's their back or their knee or whatever. With necks and backs, we do spinal decompression, we can do injections, we can do chiropractic, and all these things help to get people their function back and get out of pain so they can do the stuff they like to do.
Are they instantaneous? You come in and have your spine decompressed and it's better, or are these ongoing treatments?
I wish it was instantaneous, but it's not. Decompression and, you know, chiropractic, they're working with your body so that it actually heals and that it actually functions. And that takes, you know, in most cases, about 1 to 3 months.
So you mentioned spinal decompression. What exactly is that? Stretching your spine out?
It is. You know, spinal decompression is an awesome modality where we can do the neck or we can do the low back. And what it comes down to is, you know, we have discs in our spine and they don't have a big blood supply. So when they get injured, they kind of dry out, they get compressed, then you get disc bulges and herniations and all that nasty stuff. What spinal decompression does is it helps the discs kind of pump in water, nutrients, oxygen that allows that tissue to heal. And that's really important because when you get that inflammation out, it can stop irritating the nerves that are giving that sciatic pain or the pain down the arms. So it works really well and our patients love it.
It's not a one-time thing.
It's not a one-time thing, but it's not a forever thing either. But we want patients to do decompression for long enough so that we help them heal and that their condition isn't going to go back the way it was, because we want to get all that oxygen, water, and nutrients into the disc so it can heal.
And then how do we get a hold of you if we want to get some help?
The best way to get a hold of us is to go to our website, renoregen.com, or you can give us a call.
Thank you so very much for joining us.
Thanks for having me.
Dr. Lloyd Decker with Reno Regenerative Medicine.